Good morning, everyone. Today we approach a profoundly important aspect of nursing, communicating during advanced age, palliative care, and the end of life journey. This conversation requires not only English proficiency, but also deep empathy, sensitivity, and skill. We will explore how to listen effectively and speak compassionately to this challenging situation. By the end of the session, we will be able to adapt your English communication for elderly patients, understand the goals of palliative care talk, use appropriate English phrase for these sensitive topics. Practice deep listening, speaking with empathy, and consider cultural differences. Communicating well in these situations is perhaps one of the most important things we do as nurses. It builds cruel trust, upholds patient dignity, helps relieve suffering in all its forms, support family through immense stress, and fulfill our core ethical duty to provide compassionate care. When communicating in English with older adults, we must adapt, be mindful of potential hearing or visual loss, speak clearly, and ensure good lighting. Slow down, be patient, and show respect. Use simple language and, most importantly, listen to their story and concerns. Active listening is crucial here. It's more than just hearing, it's understanding. Pay attention, use nonverbal cues, reflect what you hear, both facts and feelings. Use phrases like it sounds like to show empathy. And don't be afraid of silence sometimes. It's when people gather their truth. Our speech should be clear, respectful, and gentle. Always introduce yourself. Explain procedure in simple English. Offer choice whenever possible to promote autonomy. Check if the patient understands and maintain a calm tone. Even when discussing difficult topics, you can introduce yourself clearly, explain clearly. This is the example of the sentence that you can use, like, "Hello, Mr. John, I am Natalia. I will be your nurse today." And then explain clearly, "I need to give you this medication now. This is for your blood pressure." And don't forget to offer choice. Would you prefer to sit in the chair now or a little later? And please check understanding. Does this make sense? Or can you tell me what we just discussed? Don't forget to use a calm and gentle tone. Now, listen to Mrs. Davis. And what is she really telling you? Identify her different concern. Okay, I will read script now. This is the Mrs. Davis speaking. "Nurse, is just I don't sleep well. The nights are so long. I think about, well, everything. My George has been gone 10 years now, and this hip is arched. They said I should walk more, but it's hard. I just feel like a burden sometimes." Okay, now from that Mrs. Davis speaking. Now, what are her main issues, and how would you respond? And particularly in English, please discuss with your group. Let's see, she has like insomnia, right? Loneliness and grief. She has pain, feel like a burden. So the response, you have to be very careful about that. You have to take care of her her feeling of lonely, also her physical pain. Let's talk about how we can help your hip pain, something like that, to make you more comfortable. Okay, don't forget about that. Let's define palliative care. So it's not just the end of life care, but its main goal is to improve quality of life by managing symptoms and addressing emotional, social, and spiritual needs. It can start early and be given without treatment. Communication is absolutely central to palliative care. Okay, quality of life, symptom relief, holistic needs, alongside treatment and communication is very important for 5 things. In palliative care, we must listen deeply to understand the patient's goal and fear. What truly important to them? What are they afraid of? We use open-ended English questions like what matters most to you to open their vital conversations. Okay? When you're hearing some matter, you have to think about the meaning and value of them, the biggest worry, hopes, and involved indecision. The open-ended question is very important. Avoid to use close yes or no question. Open-ended question like what is the most important to you right now? Or what are you hoping for? Or what worry you most? Something like that. And don't forget to give time for them to express their feeling, to express their answer to you. We also need to speak clearly about treatment options, symptom management, and sometimes advanced care planning. Always focus on comfort and quality of life. Use simple English and check for understanding. These are often team-based discussion. Okay, don't forget these 4 important things. Explaining options, symptom management, advanced care planning, and focus on comfort and quality. Let's review some key English terms used in palliative care. Match this term to their definition. Let's go. Okay, 1. Comfort care. What is it? It's met with D. Okay, care focus primarily, relieve suffering, but not will them. And number 2, symptom management. What is it? It's met with B. Okay, focusing on relieving pain and other distressing symptoms. Come to the third one, advanced directive. Advanced directive, what is it? It is the legal document starting future healthcare wishes. Okay, and the last one, number 4, quality of life. It is an individual perception of their position in life. These 4 terms are important when you need to understand about the palliative care. Okay, don't forget about it. Discussions about death and dying are profoundly influenced by culture. Who holds the power? How directly do we speak? What rituals are important? We must be aware of their differences, including common Thai perspective as well, and always approach each patient and family in with the respect, asking about their specific wish. Okay, culture, date and dying, culture announced, key consideration, Thai context or the other context is up to you. And golden rule, always be aware, be respectful and ask questions, never make assumptions. Sometimes the most important needs aren't spoken directly. We need to listen for hints of spiritual and emotional distress, fear, or the needs of closure. This requires being fully present, patient, and attentive to the both words and silence. Having difficult conversation in English requires skill and sensitivity. Prepare well, choose the right setting, check what the patient already knows, give information clearly and simply, and most important, respond with the empathy. Acknowledge emotion, allow silence, and always discuss with what happened next. Okay, this is important one. Having a few key English phrases can help in these moments. These phrases show presence, validate feeling, offer comfort, and open door for the future conversation. Practice saying them with a warm, empathic tone for your voice, okay? Like, I'm here for you. Okay, the first one is simple and powerful statement. Number two, it sounds like this is very difficult. So it's acknowledge their feeling, okay, with empathy. We will keep you comfortable. Okay. This is resume them about the pain and symptom management. The next sentence. What is most important now? This is empower them to focusing on their priorities. Is there anyone to call? Offer practical help with connecting with the loved one of the patient. The next one, it's okay to feel. Is normalize their emotional reaction and experience. And the last one, I'm sorry you are going to do this. Express compassion for their suffering. Okay, don't forget word and your acting and your voice tone is important. It can go together. Now meet with Mr. Tanaka. This is our case study. It's your assignment. He is facing a transition to palliative care and has mixed feelings and fears. He misunderstands what palliative care means but has a clear goal, seeing his granddaughter graduate. This is his goal. This is a cruel communication moment. Mr. Tanaka is the Japanese. He is 75 years old. As one lung cancer now, curative treatment are not longer effective anymore. He speaks English well. Doctors suggest palliative care. How would you address Mr. Tanaka's specific concerns? And this is his concern. Palliative care, does that mean I'm dying? See, I don't want to be in pain. I don't want to just give up. I want to see my granddaughter graduate next month. This is his goal. Okay, let's go. Now your turn. How would you address Mr. Tanaka's specific concern? Okay, let's go. Let's role play this conversation. The nurse needs to listen to Mr. Tanaka's fear, explain palliative care clearly in English, and then speak about how it can support his personal goal. Focus on empathy and clear explanation. Okay, this is the step of your role play. For this conversation, listen actively, explain palliative care, knowledge goal, and connect care to the goal. Okay, practice yourself with the partner. And our second case study is involve family conflict at the end of life. A common challenge. Mrs. Bunmi has made her wish known, but her daughter is struggling to accept this, highlighting different culture and emotion response within one family. Different. The patient situation, Mrs. Bunmi, 85 years old. She is Thai. She is actively dying. She has an advanced directive in Thai. It states no heroic measures. But for the family dynamic, her eldest son, English speaker, understand and agree, but her daughter is like this trait. We must do everything. It's our duty. See, it's different. Now, how are you gonna deal with this? In your group, discuss how you would in your group, please discuss how would you navigate this difficult family situation. How do you listen to both siblings? How do you speak to the daughter with empathy, but also uphold the patient's wish? What English phrase would you help? And who else should be part of this conversation? Please discuss with your group. And here, so I give you like a clue. For understanding perspective, listen to both son and daughter to grasp their views. You have to acknowledge feeling and respect patient wish. Use empathic phrase that we mentioned about it before. Refer to supportive phrase from earlier. They offer comfort. And involve the team like doctor, social worker, and spiritual healthcare worker together. And this is the key. In conclusion, compassionate communication in English is a learnable skill, vital for elderly, palliative, and end-of-life care. Be culturally aware is very important. And please remember to take care of yourselves. These situations are tough. Be brief and support each other. Thank you. Are there any questions? Okay. If you don't have questions, we can see into the next session.